Do you know the differences between Medicare Part A and Part B? In this video, I will try to provide a general overview of the differences between them using information from the Centers for Medicare and Medicaid Services, or more commonly known as CMS. I want to try to keep this as an overview video though, so I've made a number of other videos on questions that this may raise in your mind, and I've linked them in the description below. So what is Medicare Part A? Medicare Part A is commonly referred to as hospital insurance. It primarily covers inpatient care and facility-based services, including inpatient hospital stays, skilled nursing facility care, there's a video in the description below, certain home health care services, hospice care for individuals who qualify. Part A is generally financed through payroll taxes, such as FICA taxes paid during a person's working years, although your paid taxes don't necessarily relate to your Medicare treatment that you received. So how does the coverage work? Part A coverage is based on benefit periods, not calendar years. A benefit period begins when a beneficiary is admitted as an inpatient. It ends 60 consecutive days without inpatient or skilled care. I also have a video on why treatment ends after 60 days, and you may want to check that out in the description below. Now, you may be asking, is there a limit to the number of benefit periods? And the answer is no. There's no limit to the number of benefit periods, but each period has its own cost-sharing requirements. So some example of cost you may incur for hospitalization is your deductible for days 1 through 60, daily co-payments for extended stays beyond 60 days, and then coverage is limited after your lifetime reserve days are used. Again, for this topic, see my video below. Limited lifetime reserve days is its whole other topic. So skilled nursing facility coverage is covered only after a minimum 3 days of inpatient hospital stay. Medicare pays fully for the first 20 days, and then days 21 through 100 require daily coinsurance. After 100 days, Medicare does not pay for this care. And a key point is that Part A focuses on facility-based and inpatient care needs rather than routine or outpatient services. If there's something you would like more information on, please comment below or call my office at 864-686-7201, and I'd be happy to explain in more detail. So second, what is Medicare Part B? Medicare Part B is known as medical insurance, and it covers outpatient and professional medical services, including doctor visits, outpatient hospital care, preventative services such as screenings or diagnostic tests and lab services, ambulance transportation, and durable medical equipment. CMS defines Part B as voluntary coverage that's funded by the federal government, contributions, about 75%, and then monthly premiums, which are paid by the beneficiaries like you, and that's about 25%. Now, the voluntary part is interesting. I've made a video on this topic as well. I'll drop that in the link. I'll drop that link in the description below. Now, how coverage works is that Part B generally pays 80% of the Medicare-approved charges after the beneficiary meets an annual deductible. The beneficiary is responsible for the deductible and then the remaining 20% coinsurance. Now, this can add up easily to hundreds of thousands of dollars over your lifetime, depending on your health situation. That's why Medicare Advantage and Medigap plans have been created to help with these costs. If you have questions on these, you should call my office, again, 864-686-7201, or see the description below. You may be wondering about preventative services in Part B. Many preventative services, such as screenings for chronic conditions or cancer screenings, etc., may be covered without cost sharing if eligibility criteria are met and the provider accepts the Medicare assignment, which is to say the doctor accepts the Medicare determined rate for the screening. So the key point for Part B is that it focuses on medically necessary outpatient care, physician services, and preventative services. Okay, so in closing, what are the key differences between Part A and Part B? Medicare Part A covers inpatient and facility-based care funded primarily through payroll taxes. It uses benefit periods. and it includes hospital, skilled nursing facility, hospice, and limited home health care. Medicare Part B covers outpatient and medical services, funded through premiums and federal funding. It uses an annual deductible and a co-insurance model. It includes doctor visits, preventative care, medical equipment. Both Part A and Part B together are often referred to as Original Medicare. And understanding the distinction between Part A and Part B is important when reviewing your Medicare coverage options. Again, I just want to make a note that their Original Medicare is your primary insurance. If you just sign up for Original Medicare, that's your primary insurance. There's Medigap policies, which can be secondary insurance to help you with the remaining costs that you're stuck with. And then the Medicare Advantage, it functions a little bit differently, and it actually replaces Original Medicare. But there's lots of questions on this, and so as always, for complete and official information, you should refer to Medicare.gov or the Medicare and You Handbook, or you can contact CMS directly, or you can reach out to me and my office, and be happy to set up an appointment, and we can discuss your questions and hopefully help you get set up with what you need. So, hey, visit my website, www.tomchapmaninsurance.com, and schedule an appointment. Stay happy, stay healthy.